Hi, this is Dr. Prashant Murukar. I'm a plastic and cosmetic surgeon based out of Mumbai and the United Kingdom. I'm doing this video to explain how I manage my gynecomastia patients. Gynecomastia or male breast enlargement is an extremely common condition. About 20 to 30% of young men are afflicted by this problem. It happens because of a hormonal imbalance during the pubertal period, and it can be quite disabling in terms of the cosmetic appearance and also the psychological implications of having enlarged breasts for young men. So here we have this patient, a young 32-year-old male with grade 2 to grade 3 gynecomastia, a mixed excess of both fat and gland on his chest. He has a bit of puffy nipples and deep grooves under the breasts. Here he is, all marked up. The inner circle shows the extent of the gland. The outer circle shows the extent of the liposuction to remove the excess fat buildup on his chest. We are also going to do liposuction on the side of the chest, and we are going to try to define his pectoralis muscle by doing aggressive liposuction along the breast fold and the lie of the pectoralis muscle. All the liposuction is going to happen through this small hidden incision, which is about 4 millimeters, that is placed in his armpit, and another incision that is based at the junction of the areola or colored skin of the nipple and his chest skin. So cosmetically, these incisions are very hard to notice after the healing has taken place. As I have said earlier, we are also going to define his chest better by sucking out the fat excess on the sides of the chest. So here he is, all marked up, ready to have a surgery. We do this surgery under local anesthesia. The patient is sedated but awake. He doesn't feel any pain. In this step, I'm using a blunt tube of about 4 millimeter diameter to inject a lot of numbing solution into the area from where I am going to do the liposuction. As you can see, other than supplemental oxygen, the patient is awake and completely comfortable. We inject a solution of saline mixed with local anesthesia and adrenaline, and once that has acted over a 15-minute period and everything is nice and numb, we start the liposuction. Here I am using the stealth incision to suck out the fat both on the front of the chest and in the gland behind the nipple and areola with a 4 millimeter tube. Now, having completed liposuction on both sides, we make a small cut at the junction of the areola and the normal skin of the chest, and we dissect out a gland which in most instances looks white with a little bit of fat interspersed amongst the gland. Once the gland is completely out, here you can see the right gland and the left gland taken out from the incision. We have checked the contour of the chest, made sure that both sides are symmetrical, that there is no further gland tissue left behind, that the contours are good. We are going to stitch up these cuts with dissolvable sutures and then give him a dressing and a pressure garment which he will have to wear for a period of a month. These are the patient's before and after views, which clearly shows the beauty of gynecomastia surgery. It can completely transform a young man's life. The chest can become flatter, the muscles better defined. No longer does he have to be embarrassed about his appearance on the beach or in the pool or in the shower. He just ends up being more comfortable and confident about his own physique. This is the side view of the patient, showing the degree of flattening that we can get from the surgery from both the sides. So all in all, a very gratifying surgery both for the patient and the cosmetic surgeon. It is not a problem you need to suffer from. You just turn up to the local plastic surgeon's office and get the guidance about how you can get this condition sorted. These are the fat and the gland that has been removed from this patient. So anyone who suffers from gynecomastia doesn't need to spend a lot of time mulling over the possibilities. They need to come and have the liposuction done and the gland removed